Hello there everyone, my name is Kamran Bhopal and I've recently gotten an NTN number in, and this is an ST3 urology history taking station for urinary incontinence, specifically stress urinary incontinence. And the scenario usually comes with a 34-year-old lady or 40-year-old lady with a high BMI. So they're telling you risk factors of stress incontinence. High BMI with 4 children, has presented to the clinic via GP referral with symptoms of leakage on coughing or sneezing. So basically they've given you out the scenario of stress urinary incontinence. This station is primarily focusing on how you take a history of stress incontinence, and the way I have prepared the history, I'm going to present it to you. So I will see this patient in a dedicated continence clinic with an ICIQ questionnaire and a bladder diary, ideally in the presence of a urology specialist nurse or a continence nurse. I will look at the referral letter or any relevant investigations such as urodynamic studies. I would check the patient's understanding why they've been referred and also confirm the identity. My main aim will be to classify the type of incontinence and determine how this is affecting the patient's quality of life. I will take a focus history of lower urinary tract symptoms and classify this incontinence into stress, urge, or mix. Stress such as leakage on coughing, sneezing, or lifting, or sudden need to go to the toilet, and leakage and mixed where both of these are present, and in that case I will ask which one is worse. And this is looking at trigger factors to classify urinary incontinence. I will ask for the onset, duration, progression, and the severity of symptoms, and also ask for the number of pads that the patient is using if she is using any, and rule out any urinary tract infection symptoms such as foul-smelling urine, dysuria, flank pain, fevers, etc. I will ask for any lower urinary tract symptoms which are associated, such as storage and voiding symptoms. I will also ask about red flags such as weight loss, hematuria, neurological symptoms, and continuous leak indicating a fistula. I would also ask about lifestyle, fluid intake, caffeine intake, tea or coffee, alcohol, fizzy drinks, and obesity and BMI. I would also check for predisposing causes of stress incontinence, asking for past medical and surgical history, which is number 1, pelvic surgery, any other urological procedures such as stones or catheterizations, radiotherapy, then neurological causes such as multiple sclerosis or spinal cord issues, number of children, vaginal deliveries, last menstrual period and menopausal status, and heart failure, diabetes, and chronic kidney disease. I would ask for any medications such as hormone replacement therapy, alpha blockers, anticholinergics, beta-3 agonists, anticoagulants, diuretics, and any allergies if present. I would ask for family history of urological cancers and also take a social history, asking about smoking, alcohol, performance status, and general fitness for surgery, and how all of this is affecting the patient's quality of life, and close the history asking about the ideas, concerns, and expectations of the patient. Now you'll notice some places I have repeated a few things. So this lifestyle I used to sometimes forget after the red flags, although it is important to mention after the red flags way up in the history so that they know that you're talking about this. For some reason, whilst I was doing the LUTS history and the red flags, sometimes missed this lifestyle and jumped directly onto the predisposing causes. That's why I always at the end in the social history, as a marker, I've kept in mind that I also ask about alcohol and smoking and dietary history. If I've forgotten that, I can ask it later and then I never miss it. But you don't have to say it twice. It would be good if you asked about the lifestyle way up and not lower down in the social history. But it is something to keep in mind that you have your own backup mechanisms. If you forget, you sort of can find a place where you say it later down the line. I hope you enjoyed and learned from this video. We'll do a separate video with the type of questions, surgical management, etc. for stress incontinence. Until then, good luck and hope you all get a NTN number. I'll see you next time.